Thank you, everyone, for being here. I can kick it off. Today, our theme here is leadership in medicine. We consider leadership now as more of a dynamic context through various organizations, industries, disciplines, and there is no single blueprint for success in it. And that's why we would like to share your insight in navigating and finding the best path forward. It is my privilege to introduce Dr. Raed Dweik, who is chair of Pulmonary Critical Care Medicine and chief of Integrated Hospital Care Institute at Cleveland Clinic Medical Center, and current president of American Thoracic Society. And I have the next panelist as Dr. Shelgikar, who is the president of American Academy of Sleep Medicine this year, professor of neurology and sleep medicine fellowship program director at University of Michigan Medical School. Thank you for joining us today. We do have one more panelist we are waiting for. I hope we will be joined by Dr. Friedman very soon. Taking things away, my first question actually to both the panelists here are, when did you join the society you now lead? And give us like an approximate year and the first initiative you worked on. And we'll start with Dr. Shelgikar.
Great. Yeah, thank you for the question. I first joined the American Academy of Sleep Medicine when I was a sleep medicine fellow. I admittedly don't know if I'd ever heard of the organization before that time, so I was brand new to it. My attending said you should join, so I said, sure, I'll join. And everything was around 2008 when I joined, and kind of just, so got the emails, was a member, and I didn't do anything, so to speak, until I joined the faculty at the University of Michigan, and that was the first time that I submitted a session proposal and happened to get accepted. And that's when I felt a little bit more connected to the work of the academy and the sleep meeting in general. So kind of built on it from there, but started in fellowship.
Okay, thank you. Dr. Dweik.
Yeah, similar experience. I'm going to date myself here. So I remember the exact year. It's 1994. And I was a fellow, pulmonary critical care fellow as well. And the meeting was in Boston. So that was my first meeting for the American Thoracic Society. And I've never missed a meeting since then. It was the first and last meeting that I did not present or do something at the meeting. I was there, as they describe it, like a kid in a candy store. There's so much in these meetings. Like, it was really overwhelming. But then you learn a lot, you meet a lot of people, and really I never looked back. I've been submitting abstracts or giving talks or in assemblies or committees since then. So now 32 years. So it's been an amazing experience. Actually, when you become a member in those days, I don't know if you guys still do this, I got a certificate signed by the president that I have been selected. It's almost like the fellowship now, like you've been approved or selected as a member of the society, and I had it framed at the time, no longer that. I had to dig it up when I became president. I showed it in my presentation as this is the certificate that we no longer do that, but I have a certificate with my name and number, ATS number. So it was a big deal at the time. Still is, I think, but we had more fanfare around it than we do these days, being a member of society. So thank you.
Thank you so much. Thank you. I do think you are one of the minority to go every year and make an impact right there. The next question actually is also to you, Dr. Dweik. How did you start actively getting involved beyond the regular attendance, like, more meaningful initiatives that were close to you or where you wanted to be more involved in your primary focus of work, sort of?
Yeah, this is a great question. I get asked this kind of all the time. And actually, when I gave my inaugural presidential presentation, I kind of described my career track at ATS and how it happened. It's really a progressive track. So I started by the next year, literally, I submitted a couple of abstracts. So I gave a poster presentation. The year after that, it was better science. So I got a podium presentation. And within a couple of years, I was asked to give a sunrise seminar, which is really, this is one that you get invited to. It's kind of scheduled. People pay to kind of listen to you kind of thing. It was kind of exciting as an early faculty. And so these are the first, probably I would say 5 years or so, was submitting abstracts, giving talks, or being in symposia. And then I think about 5 or 6 years into it, I started exploring assemblies. And I don't know how every society is structured differently. They are really interest groups, if you want to think about them. So the ATS has the assemblies. And I explored several of them. We have about a dozen or more assemblies, and I almost explored half of them before I decided which one is going to be my home assembly, because they all offered something what I wanted, but not everything I wanted. So I ended up doing the basic science one, then the clinical one, then the occupational one, and kind of around and around. But eventually, I ended up with the pulmonary circulation, which is my area of interest, which had a combination of all of these. So it's really the assemblies is how I entered. After that, when you get engaged in the assemblies and you get recognized that you are engaged member, you do things, you're volunteering, I started serving on committees. So I did the education committee or the implementation committee, and that's really when you become part of the fabric of a society, and you understand it at a different level when you serve on committees, because they have certain charges and that you have to have. They have milestones you have to deliver on. They have objectives and goals, much more structured than the assemblies. The assemblies are more like interest groups coming together and trying to get things done, but the committees are more structured. And then from committee member to committee vice chair to committee chair, that's kind of how the progression really happens.
Thank you. Thank you so much for such a detailed reply. It's actually very interesting to find out the career path, and I know like it sounds short, but I'm sure there's so many hours that went into this whole
Yeah.
journey, and a lot of collegiality too. Dr. Shelgikar, I would like to ask you, what would you say to a fellow or a young faculty who's just starting out on their journey and they want to get involved and they want to be in it long term and to make a meaningful impact?
Yes. So I say no time like the present. It's great to get involved, and that can feel a little overwhelming. How do you go about doing that? These are really big organizations, right? You get a little starstruck when you see the names on the programs of who's presenting and who's winning awards and how could I be part of that organization? But we all started off as nameless, faceless people in our organizations, but really just having a desire to be part of something. And I think having that desire is a great place to start. So I would say, explore what these organizations have to offer, whether it's assemblies, like was mentioned, or different committees, or even different webinars or activities. Look at their website, see what they offer for their members who are in practice, who are doing research, who are doing all of the above, who are educating. What are their coding resources available? Our organizations do a lot for our members and for our patients, and to help our members serve our patients. And so first explore, see what's available. And start by making sure that you are on the email list for these societies, making sure they're not getting filtered to your spam folder. There's a lot of thought and care that goes into these blasts that's sent to our membership, and you can click on hyperlinks for, oh, I'd like to attend that, or oh, I'd like to volunteer and apply and submit my application. At the American Academy of Sleep Medicine, we have a platform called Engage, where it's really member to member discourse. Someone may pose a question, a clinical question, or a coding or reimbursement question, and people will then weigh in with their expertise and with their perspectives. And it's a really great way of forming that community and feeling to be part of the community. So I would say, even from your own workstation, your own office, your own home, you can get involved and get connected with other members. And then you can start slow by getting involved in committees and things like that. At AASM, we also have I'm proud that we started last year when I was chair of the committee on committees. We started these strategic ambassador roles. And so these are micro volunteer opportunities. They're not a heavy lift. They're just really task-oriented volunteer opportunities. So if you're a little ambivalent or hesitant about how much time you have, you can start small and then continue to grow from there. So I think lots of opportunities to explore and build those relationships.
Thank you. Thank you so much. So we need to do some research and find out our primary interest and focus, I guess. My next question actually is to both of you. Hi, Dr. Friedman. How are you?
Sorry I was late. I just had a hard time finding the link. Actually, Helene and I have been emailing back and forth to get me to this place. So
No,
sorry.
but we really appreciate you being here. Thank you so
I was
much.
watching. I just couldn't get onto this part of the
Oh
program.
no, I'm so sorry. I feel like now we do have this email bloat now between so many emails between all of us and links. But thank you so much, and I'm so
Sure.
glad you're here. For everyone, I would like this time to take this time to introduce Dr. Neil S. Friedman here, who's president of American College of Chest Physicians this year. He's a clinical professor of medicine at University of Chicago School of Medicine and president specialty care of Endeavor Health Medical Group. Thank you so much. We did do a couple of questions, and we started about how to start our work in the societies that you're a part of. And my next question actually is to all of you on the panel here. What has surprised you the most about being the president of your society? And we'll start with you, Dr. Friedman.